The number of COVID-19 cases continues to rise globally and right here in Guyana. Therefore, we encourage everyone to practice social distancing, wear a mask if you have to leave your homes, and wash your hands thoroughly and frequently as we strive to stop the spread of the virus. Welcome to InfoHub for Thursday, June 18. Thanks for joining us. The National COVID-19 Task Force has announced a 6-phase reopening of Guyana, with Phase 1 commencing today and lasting until July 2. Details in this report. The curfew, 6 p.m. to 6 a.m., will remain in effect for Phase 1 in all administrative regions. The non-curfew measures will be lifted in Regions 5 and 8, which to date have not been affected by COVID-19. During Phase 1, the following will apply. All food establishments, including street vendors, will be permitted to operate takeout and delivery services from 6 a.m. to 6 p.m. No dining services will be permitted at these locations. Hardware, plumbing, and electrical stores will be allowed to operate from 6 a.m. to 5 p.m. 90 minutes of exercise is allowed for citizens Monday to Friday from 6 a.m. to 6 p.m. in open public spaces. Public transportation will be permitted to continue to operate at 50% passenger capacity. Social distancing rules and the wearing of face masks must be maintained. Bars are to remain closed. No contact or team sport is allowed. Gatherings of more than 5 persons remain prohibited. Stay-at-home order remains in effect. Persons are only permitted to leave home if they are essential workers, for essential services, emergency medical care, and for the 90-minute daily exercise allowance. Phase 2 will be from July 3 to 16, Phase 3 July 17 to 30, Phase 4 July 31 to August 13, Phase 5 August 14 to 27, and Phase 6 August 28. Up to news time, a notice of motion was filed in the Court of Appeal and served on the chairperson of the Guyana Elections Commission, Justice Retired Claudette Singh, and Chief Elections Officer Keith Lowingfield. According to GCOM's Public Relations Officer Yolanda Ward, the notice was served on the CEO before 13 hours, which was the deadline for submission of his report. The notice restrains the CEO from complying with the directions of chairperson as a consequence of a report was not submitted. The Commission will meet as planned. Stay tuned to our social media platforms and website for further details. Guyanese who have been stranded in several countries due to the COVID-19 pandemic are being repatriated. However, several guidelines must be followed to ensure their safety as well as the rest of the Guyanese population.
Chief Medical Officer Dr. Shamdio Prasad has shared the procedures that will apply to any traveler arriving by commercial or private aircraft at the Eugene F. Correa International Airport and the Chedi Jagan International Airport.
Persons returning by airlines will be screened at check-in and boarding by the airline. Temperature, symptom checks, health assessments, and other COVID-specific exit or entry screenings will be applied in accordance with IATA's guidelines. Travelers should provide proof of negative PCR tests not more than 48 hours before traveling.
The CMO has also outlined some of the do's and don'ts that must be strictly followed after boarding.
While on the flight, all persons should maintain physical or social distancing and observe seat spacing as advised by IATA. Wear face masks covering the nose and mouth throughout the journey except when eating, drinking, or taking medication. Practice proper hand hygiene and avoid any physical contact. Avoid standing in the aisles, galleys, and washroom areas.
Recently, 170 Guyanese were repatriated. They arrived on June 6 and another batch on June 17. In coming days, cruise line workers and other Guyanese who visited other countries for vacation or business or have been working abroad will soon return. For InfoHub, Delicia Haynes.
The Civil Defense Commission has mobilized resources and is on standby to offer support to Regions 5, 6, and 9, which have been experiencing adverse effects from the heavy rainfall over the past few days. At this time, Region 9 is the most severely affected, with flooding in several communities and several others are on the watch list for possible evacuation. The regional chairpersons are monitoring the situation in their respective regions, are in contact with the CDC. Residents who are experiencing flooding during this period can contact the National Emergency Monitoring System 24-hour hotline service on 623-1700 and 600-7500 for assistance. Residents are also being asked to pay heed to flood warnings issued by the Hydromet office and to take all preventative measures. More news after this short break. Stay with us.
The COVID-19 pandemic has had a devastating effect on communities all across Guyana. Many households and individuals now find themselves in need of public assistance. The government of Guyana will be assisting the most vulnerable. Those eligible to apply for this assistance are as follows. Individuals and/or households who are currently benefiting from public assistance provided by the Ministry of Social Protection. Individuals and/or households who applied for public assistance and are awaiting a response from the Ministry of Social Protection. Individuals and/or households who suffered a loss of income due to COVID-19, and households headed by senior citizens or persons with disabilities. Application forms can be downloaded from the Ministry of Social Protection's website at www.mosp.gov.gy or government.gy/eform/241. For further information, please call these numbers. We are in this together. This is a message from the Government of Guyana. We are here to serve you.
Welcome back. The Civil Defense Commission has extended the deadline for the submission of expressions of interest from suppliers such as supermarkets and shops to supply items for a COVID-19 pandemic assistance voucher program. The cutoff date for submission is June 24, 2020. The CDC explained that the objective of the program is to provide relief to vulnerable citizens during the COVID-19 pandemic through the supply of hampers and care items. Interested suppliers should specify their capacity to supply canned and bottled food product and dry and fresh ration at an estimated value between $25,000 to $32,000 monthly per voucher. Those suppliers who are successful will have to ensure that their business has adequate space available that is in compliance with the Public Health Ministry's social distancing guidelines and the establishment of sanitation facilities. It is advised that interested persons or authorized representatives submit completed forms along with business registration and recent NIS scheme and Guyana Revenue Authority compliances to the Civil Defense Commission office. Further details can be found on our website. More COVID news. As cases rise to 8 million globally, the call for treatment for the coronavirus has become more widespread. Scientists in the UK have responded to the call with the first-hand treatment proven to reduce death rates. Akisha Bodhi has the details.
The World Health Organization, WHO, is congratulating the United Kingdom as recent studies have yielded the first ever treatment shown to effectively reduce mortality rates in critically ill COVID-19 patients. Researchers in the UK found that dexamethasone, a common steroid used to treat inflammation and some cancers, to be very effective in treating the critically ill patients.
This is a very, very powerful anti-inflammatory drug. It can rescue patients who are in very serious condition where their lungs and their cardiovascular system around their lungs may be very inflamed. So this allows possibly that patients are able to continue getting oxygen into their blood from their lungs for a very critical period by rapidly reducing inflammation at a critical period in their illness.
Preliminary results revealed that the mortality rate for patients on ventilators was reduced by 1/3, and mortality for patients requiring oxygen was cut by 1/5 with the drug. While this is good news, Dr. Michael Ryan, Executive Director of WHO's Health Emergencies Program, said that testing is still at a preliminary stage and there are associated risk factors.
It is not a treatment for the virus itself. It is not a prevention for the virus. In fact, steroids, particularly powerful steroids, can be associated with viral replication. In other words, they can actually facilitate the division and replication of viruses in human bodies. So it's exceptionally important in this case that this drug is reserved for use in severely ill and critical patients who can benefit from this drug clearly.
The drug is only for critically ill patients, as it was shown to have little effect on mild symptoms. Dr. Ryan also stated WHO will not change any of its current clinical practices or recommendations until the final data is submitted and assessed. For InfoHub, Akisha Budi.
Remember to do your part to ensure you do not put yourself at risk during this time. If you have a cough, fever, and difficulty breathing, seek medical care early, but call the hotline first. That's all for today. Connect with us on all our social media platforms, including WhatsApp, Facebook, YouTube, and Instagram, as we bring you the latest and important news related to COVID-19 and much more. Also, subscribe to our website, dpi.gov.gy. Your Bridge Report is up next. Goodbye for now.